Hi, I'm Jay Shubrook, a professor and diabetologist at Touro University, California, and I'm here today to share some important messages about the flu vaccine. As always, this is part of the Connect with MOBEC series, and we're here to help engage you, inform you, and help partner with you to find your optimal health. So I know that this has been a hard year. We've had COVID, we've had fires, we've had smoke, and now we're heading into the holiday season, which means it's also the flu season. And this has really been overbearing, and I know that we're really struggling. But this is an important message that we take some time and think about, because we don't want to be caught with the dual problems of both influenza and COVID. And we're going to talk a bit about why it's more important than ever to get your flu vaccine. So why are we talking about flu in the time of COVID? We know that COVID has been very serious. It's had many impact on most of our lives, but we know that flu, while it's something that comes every year, is also quite serious. You can see the ranges here over the last decade in terms of deaths, anywhere from 12 to 61,000. Anywhere from 0.5 to 1 million people get hospitalized, anywhere from 9 to 45 million people get sick. So in some respects, this can be even higher than COVID on any given year. And to make it even more personal, if we just look at last year, 38 million people got sick from influenza last year, resulting in 18 million medical visits, 400,000 hospitalizations, and 22,000 people died from influenza. Now, it is important to know that every year influenza is a little bit different than the year before. And the vaccine is specifically developed for what we think is coming that year. And so the people who develop these vaccines actually are watching the trends in the virus as it changes and then modifying the vaccine to match that. And so each year this vaccine is unique and specific to the virus that's coming. Who should get the flu vaccine? And there's a number of priority groups that should get the flu vaccine. First of all, we know there are high-risk age groups. So any young children between 6 months and 4 years old should be getting an annual flu vaccine. Those who are above the age of 65 are very high risk and should be getting a flu vaccine. And then certainly pregnant women. If you have an underlying medical condition that's making it more likely that you'll have a severe case of the flu, like lung disease, anyone with asthma, emphysema, or COPD, or if you have heart disease, or as always, diabetes, you're more likely to have a more serious condition, and please get your flu vaccine. And then certainly anyone who's had worse outcomes with COVID, higher comorbid disease, or more likely to get very sick, as we've seen in our Black Americans, our Latinx, and our Asian and Pacific Islanders. So this is something that will affect all of us, but the disease could be worse in certain populations. And it's important to do whatever we can to prevent that illness. And I know that many of us are nervous about going out into the community when there's COVID. So we're going to talk about opportunities where you can get your flu vaccine and protect yourself from both flu and, in some respects, COVID. Who else should get flu vaccine? Anyone that's a frontline worker. So if you work where you're serving other people who might be sick, if you're in the service industry or sales industry, let's say you're driving a bus and you don't control who actually comes on there, you would be at higher risk. Anyone that's in group living. So if you live in a house with a kid, you're actually now at higher risk. Or if you're in a group like a nursing home, again, that would also put you at higher risk. And I know personally, healthcare providers and caregivers are at very high risk. And so I got my flu vaccine early this year, mostly because we really want to separate the flu vaccine or the flu illness from COVID. And if you get sick, and I don't know whether you have flu vaccine or COVID, it's going to be quite hard for us. So I got vaccinated early, and most of the healthcare providers I know have been getting this done earlier than normal this year. Now, who should not get the flu vaccine? Certainly, we don't have evidence for babies less than 6 months old or anyone that's had a serious allergic reaction to one of the components. And most people know if they have that. When is the flu season? Well, it's unpredictable. We know that we do try to track it. The flu season is about to start, and we know that you can kind of watch it nationally as it starts to pass through the country. But the most important thing I want you to know, other than I think it's still important for you to get your flu vaccine, is get it early. It takes about 2 weeks after you get your vaccination to build immunity. So you don't want to wait till the middle of flu season to get your flu vaccine, because you might not have enough time to get strong enough to prevent it. So please get your vaccine early so you have the time to build immunity And like I said, luck favors the prepared. Now, what if you're not sure about getting the flu vaccine? Of course, please come talk to, even if it's on the phone or a video visit, please talk to your healthcare provider and ask if it's safe for you. Ask which one you should get, because there are a couple different variations depending upon your age. And there is great information available locally at the state and the federal level. So you could certainly look at Solano County Public Health website, the California Department of Public Health, and the CDC. Now, why is this year special? As you know, we're anticipating and we're starting to see another COVID spike. And so this is going to be a real issue, and we'll have to do a lot more social distancing and maybe even sheltering in place as a result of the next COVID spike. And as a healthcare provider, some of the symptoms of COVID are similar to the symptoms of flu or influenza. But you cannot treat them the same. They get treated differently. And so if I don't know which one you have, it's going to create a delay in your care so I can get the proper diagnosis. We also know that anyone that has had the flu, it lowers the body defenses to other infections, including COVID. And so we really think that it's important for you to recognize that we want to prevent you from getting one, which might actually help you for both. I will say there is one good thing about COVID. Our wearing of masks, our social distancing, and somewhat keeping separate from group environments will have some mild reduction in influenza as well. Again, it's also a respiratory illness. And so the good news is that when you're taking care of yourself for COVID, you are reducing in some level your risk for influenza. But more importantly, we have very good evidence that we can help reduce your risk of influenza further with the flu vaccine, and would like you to get it. What if you want more information about the flu vaccine? There's Fight Flu Together website. There's the Solano County Public Health website. And there are many ways to get your flu vaccine this year. Many of the pharmacies are offering it. The health department actually has a list of places where you can get the vaccination. And I'm about to tell you about some other drive-through flu vaccine opportunities. So Touro University has been partnering with Solano County Public Health and Sutter and Walgreens to develop drive-through flu vaccines. Our first drive-through flu vaccine will actually be in American Canyon on November 8th from 9 a.m. to 12. And we have a second one planned for Vallejo on November 22nd from 9 a.m. to 12, a site to be determined in Vallejo. We want to have at least 4 of these in the month of November. So if you go to the Solano County Public Health website, or you go to Touro University website, tu.edu MOBEC, we should be able to get you additional information. And we're very grateful with the partnership of the other organizations, including Walgreens, who is supplying many of these vaccinations for free to the public. And again, we want to make it easier. And in the drive-through flu vaccines, you don't even have to get out of the car. You come up, you sign a waiver, you get your vaccination, you'll get some additional information, and we'll get you on your way. And again, we feel this is so important. We want to make it as easy as possible. Just a couple other announcements. I want to highlight that starting November 2nd, we're going to have a series of online free webinars for the public. Zoom into Wellness. And this is a program with 11 different webinars focused on how do you stay healthy during these challenging times. Our first week will be focused on nutrition and healthy eating. That's November 2nd, November 4th, and November 5th. It'll be every Monday, Wednesday, and Thursday. The second week will be focused on mind, body, and healthy movement. The third week will be focused on how do you stay healthy with a chronic disease. And then we'll finally launch around Thanksgiving to say, how do you stay healthy during the holidays? Like I said, these are free and open to the public. They're intended to be interactive, and I think you'll find them to be a great value. So please join us for Zoom into Wellness. And then as always, please remember that we'd love to make sure we interact with you any way we can, including through Facebook, Twitter, Instagram. And as always, please go to tu.edu MOBEC if you want more information. We have lots of information like Connect with MOBEC, but we also have 30 videos, including cooking demonstrations, yoga for people with chronic disease, as well as just really great health information. We miss you. We'll see you soon in the public with our vaccination tour, but we want to stay connected, and we're so glad that you took the time to be with us today.